Hello, my name is Thomas Forsythe, and today I will be talking to you about the Affordable Care Act, also known as Obamacare. The implementation of the Affordable Care Act is the responsibility of the Department of Health and Human Services and Internal Revenue Service, IRS. The Affordable Care Act has mandated that an additional 1,600 IRS agents be hired and trained to enforce this policy of the fees every year if you don't have health insurance. The Secretary of Health and Human Services was granted massive powers to implement this policy and to create rules and regulations as she sees fit. This is a change of how this nation does business. Usually, you're not used to seeing Congress give up its power and allow one individual to decide who gets treatment and who does not. Also, I don't think this is constitutional. This will be the first time in our nation's history that we are being forced to buy a product from someone else. Recently in the news, there's been a report that the mandate for business to provide health insurance for its full-time employees has been delayed until 2015. That is one of the biggest setbacks to why the nation did its shutdown, is Congress did not see it's right for the president to pick and choose which parts of the healthcare bill law will be initiated at each different time. Currently, the individual employee mandate has to be active by 1 January 2014, and he's delaying the employee mandate until additional year 2015. The House of Representatives passed a bill to delay the individual mandate that's slated for 2014 for the same amount of time, even though it has no chance in a democratically controlled Senate or being signed into law by the president. When this bill was signed into law in March 2010, it was not supported by one Republican. We were also told that in order to find out what is in the massive law that will affect each and every one of us in one way or another, and affects 1/6 of our economy, that we had to pass it first. These famous words were uttered by the former Speaker of the House, Nancy Pelosi. And it wasn't even signed into law through Congress. The president executive ordered this law into effect. The comment on itself has come true. We are slowly but surely learning what is in this massive 2,700 pages of the Affordable Care Act in bits and pieces along, and how it will affect us as individuals and as business owners. There are still lawsuits pending against various parts of the Affordable Care Act, and I'm sure more will follow as more details of how and what the policies will be and who it affects are released by the Secretary's syllabus. We truly do not know what to expect from this law or new policy, as the rules are being developed and implemented by the Secretary of Health and Human Services on what seems to be a weekly basis. Some of those range from the employer mandate for birth control, which are against their religious beliefs, and up to business owners with over 50 full-time employees having to provide a certain level of health insurance. Hobby Lobby and the Catholic hospitals are just an example of those that are pursuing a lawsuit over having to provide services that violate their religious beliefs. The Affordable Care Act calls for the states to set up healthcare exchanges where its citizens can go and buy a health insurance policy. As far as we've seen how well that's gone out so far. So far, 26 states stated that they will have no intention to set up a healthcare exchange. This will result in the federal government setting up the exchange in those states. Still, not working too well. When the president was out selling this new law, we were told that if we like our doctor, we would be able to keep him or her. And right now, there have been over 1 million people who have received cancellation notices from their health insurances because their health insurances do not meet the minimum requirements that is stated in the new Affordable Care Act law, so their insurance companies are having to drop them. And it's because the president and the Democrats pushed this through without thinking everything through, saying one thing and that's not coming true. We were told that our premiums would go down by $2,500. We are now seeing insurance policies go up. Doctors' offices declined to add new Medicare patients, turning away other policyholders, and some even closing up shop due to the Affordable Care Act and its new payment policy when it comes to Medicare patients. I actually have a friend who went onto the exchange and he would end up paying more for health insurance for the same type of coverage he has now, and would not receive any kickbacks or subsidies because he makes too much money. Several companies, Darden Company, which owns Red Lobster and Olive Garden, along with Papa John's, have come out and stated that they are or would be cutting their number of full-time employees to below the cutoff of 50 to avoid the cost of providing health care to their full-time employees, since these costs would drastically bankrupt them in the process. The first few companies that stated this were jumped on by supporters of the Affordable Care Act. Now you're hearing companies such as Walgreens and Home Depot telling their employees that they will now have to seek their health insurance through the exchange. Trader Joe's provided health care to its part-time employees and now is telling them that they too will have to seek health insurance from the exchanges. Walgreens and Trader Joe's both had all their employees covered with health insurance, but now because of the mandates and everything from the Affordable Care Law, they are having to cut these employees from the health insurance. However, Walgreens and Trader Joe's is providing a supplemented cost to help offset some of the costs for going to the exchange services, but it's still not going to be enough. I mean, some people get subsidies, some people don't, and the big thing on how much it costs is the subsidies. With the implementation of the Affordable Care Act in the coming months, people will be in for a rude awakening when they are not able to be seen by a primary care physician or a specialist as soon as they're used to now. The Affordable Care Act also has an independent advisory payment board, which consists of 15 board members tasked with controlling the cost in our healthcare system. There are valid concerns that this panel will decide who gets treatment and who does not. As Governor Sarah Palin stated, this board is nothing but a death panel, deciding who lives and who dies. The president has even made comments about once people reach a certain age, it'd be better if they just take a pain pill instead of seeking treatment. So basically, it's going to come down to if you have a fatal illness that cannot be cured and stuff, why pay the money out to get you your chemotherapy, to get you these expensive drugs, to prolong your life when we can just give you some pain medicine and let you go along your way is what this most likely will probably come down to. Only time will tell if we are able to rein in the healthcare costs with this new law and provide insurance to the entire population, or we see healthcare being rationed. Either way, those who have the money will still get top-notch healthcare, while the rest of us will be facing long waits for appointments and ration care, as our neighbor to the north has been doing for years. Canada has been sending a lot of their people, well, they haven't been, but a lot of Canadians have been coming to the U.S. for health services because they can get the services faster. And right now, Canada and the UK are in these socialized healthcare services, and they're trying to get out of it and sitting there looking at us and go, "You're idiots for going to a socialized health service." This country is already seeing businesses with 50 or more employees cutting back. They do not have to buy health insurance for their employees. We are seeing a massive shift of part-time workers of 30 hours a week or less in an aspect of businesses to avoid the new costs. So, and also in hindsight, that's also going to make more employees have to get multiple jobs in order to get the money that they were before, because they're no longer full-time employees anymore. That is all I have about the healthcare. I hope this was very informative for you guys, and I hope you guys see it the same way I do. If not, it's your choice.